Good morning or good afternoon, everyone, depending where you are, and welcome to today's workshop dedicated to ethics review preparedness during COVID-19 challenges and lessons learned. My name is Dr. Farah Asif, and I will be the chair for this workshop. I'm the Secretary to Institutional Review Board at Shaukat Khanum Memorial Cancer Hospital and Research Center in Lahore, Pakistan. Before we begin, we will run through some housekeeping rules. Firstly, please be aware that this session is being recorded. The recordings will be shared with a link by email in the coming days, so you can review the materials and share with wider colleagues. Please turn off your videos and microphones so that we can maintain quality and enable everyone to focus on the session. We will let you know when and how to use your video and microphones during the interactive parts of the session. To interact with the panel, please use the chat function, which you can find in your toolbar at the bottom of your screen. If you have any technical issues, please let us know in that chat box, and the Global Health Network team will aim to assist you. If you would like to ask a question verbally, please raise your hand during the Q&A session when indicated to do so, but we strongly encourage you to use the chat box. We have a dedicated session for question and answer on day 2, when we will try to get through as many questions as possible. If we don't have time for all of your questions, we will save them and try to provide written responses along with the recordings. At the end of the 2-day workshop, we will share an evaluation form by email to those who have attended day 1 or both of the days. We would be grateful if you could complete this form. So having said that, this workshop is brought to you by the Global Health Network in collaboration with the coordinators of the COVID-19 Ethics and Community Engagement Working Group. I am delighted to be joined today by Dr. Jacqueline Alger from Parasitology Services, Clinical Laboratory Department at the University Hospital in Honduras. Roxana Lizango, who is the past coordinator of Peruvian IRB Network, current member of Peru National COVID-19 IRB, and member of the Program Committee for the World Conference of Research Integrity. Julio Canario, the Managing Director of Ethicos and the President and Executive Director of the Institute of Mental Health and Telepsychology in Dominican Republic. Dr. Rumina Kazi has joined us, and she's a molecular biologist at Shaukat Khanum Hospital, Lahore. And last but not the least, Sadia Zia, lecturer at the Faculty of Life Sciences from the University of Central Punjab, Lahore, Pakistan. The workshop aims to examine the ethics review process, identifying the variation and the challenges that present. This session seeks to provide an opportunity for ethics review bodies or institutional review boards to share and discuss the problems and potential solutions afforded by the experiences so far, in an effort to ensure a more coordinated and efficient ethics review system. Today, we will be discussing the challenges faced by the global health researchers during the ethics review process in this current pandemic. So now we will begin the program for today. Following this welcome note, we will go to our networking session. Firstly, to encourage interaction and a bit of familiarity between the participant, we will move to breakout rooms in small groups with an opportunity for participants to introduce themselves to one another. This is very short. You will only have 15 minutes for this. So when you are in breakout room, please take it in turns just to introduce yourself to other participants. You can offer your name, your role, where you are from, and your research interest. Each participant, please take a maximum of 3 to 4 minutes or even briefer. The Global Health Network will now allocate you to a group, and we will return to the main meeting in 15 minutes to continue with our program. So enjoy. Thank you. And I hope you all had the opportunity to briefly introduce yourself to the fellow participants during breakout rooms. We will now continue and review two case studies exploring the challenges faced during COVID-19 pandemic. I would like to welcome our first speaker, Professor Veena Vaswani from the Department of Forensic, who is also the director at the Center of Ethics, Program Director of the Masters in Research Ethics for India at Jeanne-Poya University. She will be talking about the COVID-19 challenges from perspective of the research review process in India. So we are looking forward to hear from Professor Veena Vaswani. And Professor Veena, this is over to you now.
Thank you. Can I get the screen? Yeah. Okay. Can you see my screen?
Yes, Veena.
Okay,
Yes.
Thank you very much. I thank the TGHN for the opportunity provided to share some of my learnings and to in turn to take the learnings from here. So the COVID-19 challenges, the lessons learned from the perspective of a research review process in India. So when the largest democracy in the world went on hibernation during the lockdown, 24th March. So there were mixed responses from people, from fear to a lot of other things. But what was important was only COVID-19 became the priority in healthcare. Having said that, that also brought along with it a lot of negativism about general health and the research relating to any other things. The focus on the other ailments took a back seat. It mattered only if you had COVID and not if you had something else. But even then, one thing in the research remained and stood out. That was the COVID-related research. So immediately, there was a planning to be done from the university level, how best to treat this research. Whether to prioritize only COVID-related research, or is it possible to prioritize other types of research? But it was found that other types of researches did not hold much water, because if it involved any other reasonings, it paled in front of the communities because we had to keep them safe. Whereas the COVID-related research was thought that this is real priority because the learnings can be immediately applied and used after publication. So the COVID-related research proposals also increased, and frequencies of EC meetings. Initially, it was decided to hold once a month, which is the regular meetings, but then they increased to such an extent that they had to be prioritized. Now, with the research and the review process, they are like two sides of a coin. Due to lockdown, face-to-face meetings was not possible. So when that was not possible, we tried to use Google Meet options and meetings were organized. But you see, whenever there is a change, a person is shaken from a zone of comfort. It takes some time to get used to the newer level of working and to feel comfortable in that. So there was an initial hesitancy. Some people did not want to use the Google Meet. Some thought privacy confidentiality may not be kept up because it would be recorded. And there were a lot of apprehensions of some of the members. But it was overcome with pep talk, and especially the general discussion on change management and applied and with the COVID pandemic. People did try to look at it in a way that, yeah, something needed to be done as a part of this research review. Then was the challenge that we faced. Some members who were not institution-based, who were outside members, they showed a great deal of reluctance on accepting the online platform. When they did come on the platform, because of the internet connectivity, there was a lot of problem whether to put the video on or not, or do not put it on. Then others were not even sure one was listening to them or no, if the video was off. And there was less discussion and there was no dissent at all. It was as if the one was waiting to get this over and done with so that they could go back with the usual process of attending to the day-to-day things. Primary reviewer did most of the talking. It was like a mono acting from A to Z. And the rest either nodded or they give their assent because they were okay with it, but they had no questions. Now, clinical trials involving COVID-19 took long time to complete. Now, this is the problem being, if the documentations were incomplete, then it was very difficult to give it a go. Secondly, the problem with the consent and how it would be managed. So to manage a consent which was digital, one had to go back to the SOPs and amend the SOPs and have it accepted and then bring back. So there was a lot of back and forth with the things that were required to be done so that this process could be taken into consideration. Otherwise, we couldn't arbitrarily do the thing, even though it was for the COVID pandemic. And again, another issue was a kind of depersonalization, because there were long meetings, but there wasn't much fun, there wasn't much jokes associated, there wasn't much laughter, but it was quite monotonous. And because those days, there wasn't much to kind of socially interact, except come on the platform and discuss it. So it was leading to a kind of depersonalization. Then was the responses. The institution decided in the second week that everyone, be it ethics committee or anyone associated with institution, were to be trained, and the IT swung into action. They started sending out lectures, PowerPoint presentation, Google Meets. So some of it also had some documentaries. Some of them were outright PowerPoints, how to use and how to mark it in the calendar and how to be effective in the communication, including online etiquette. When everything is fine and we are into it, the online etiquette is not much of a problem. But if you are a learner, if you're using it for the online platform for the first time, and you leave your video and camera on, and you go to talk to somebody, and there's a whole discussion that is narrated to everybody who's sitting here. So that needed to be only as a way of documentaries and as a way of communication, do's and don'ts. So it did take some time. And COVID-19 related research, which was prioritized, and soon SOP was changed to have an emergency online review processes, where sometimes groups of 3 or 4 people together sat and decided, discussed about it, went into the pluses and minuses, what was needed to complete it. And then the Google Forms were made, they were created, and then for voting purposes, they were used. It took some time though, because the initial response of people were, is it really urgent? Do we have to do this? And how urgent is this compared to other things? And the fear component cannot be underestimated. It was so much so that people thought of all the things you're more bothered about research, whereas you should be bothering about other things. So the online, but then that also was, some people realized that there was one way to go. Some institutions who did not have ethics committees formulated ethics committees. In fact, I got invited into chair of one particular institution which was purely academic, but it went into a lot of, it got a funding because of a research proposal that they wrote. They did not have a know-how about ethics committees. So starting from training to certification programs, we had to literally, it was a hand holding for us. So we were also called to train many EC members. And we have been running the research ethics summer workshop since 2011. But the request to train ethics committees and recertify, where we also included a module on how to digitally see the protocol, how to have the minimum digital capacity to do it, and Google Forms and so on, which were incorporated. So we were called in to train, we trained around 6 ethics committees during this process. But generally, when you ask people what do you feel about this meeting, they feel it lacks the punch. They like to come to the ethics committee, have a detailed discussion, deliberate, debate, and say face to face what is good, what is not so good about a protocol, over a cup of tea, coffee, or biscuits. And they thought this was very meaningful when you look into the eye and get your thoughts out. And another important thing was many of the ethics committee members were also alternately chained with other clinical responsibilities. So even though they were in the meeting, the telephone constantly kept ringing. For instance, one of them was a nodal COVID officer, and there was not even 2 minutes when his phone didn't ring, but it was essential that he also be a part of the discussion. So it is just to say that during COVID time, some busy people got busier and busier. And so as a result, it did reflect somehow when they were a part of this meeting. Work happened, but it lacked the mirth. And there was a constant anxiety that others who appear online, they may appear online, but they may not be behind it. So we were worried whether they have listened to the protocol, they are giving their inputs based on going through, understanding, or is it just a process of completing the ritual of yes or no. And most of the members also had this constant fear of losing connectivity. And it's not only the connectivity, but the other domestic chore and the timeliness with which it was to happen was not happening. One of the laypersons also said that you are keeping meeting at a time, we are about to have water. We haven't got water for 5 days. So we can't have it. So we can have some other date. So the reasons you could think were not important, but they were really important because a lot of processes had to be adjusted according to the daily routine of starting from storing water to getting vegetables once in a while you go out and things like that. So in fact, it was a Himalayan task even to set online meeting where people found it okay to attend. And to conclude, everyone is keen on getting back face-to-face meeting, but still the members who are not from the institution are not very keen to coming back. So till then, we are still having the hybrid meetings. Those who are on the campus, they drop by, and then the meeting yet is made online for those who cannot join. There is a lot of training along with other discussions to spice up the learnings as well as take-home messages as a part of the discussion with EC members. That are valuable lessons learned when we tried using a change management as a technique when we talk to people, and we found it really hit home. And that nothing to feel despair about, because there is a way to get over the things. So these are some of the philosophies that were used while communicating with our own EC members, and resilience is the only tool, and ability to adapt should be developed by everyone. And that is one of the take-home messages in most of the meetings we talk of, because over a period of time when we have met, there are some who have had losses in their families, friends, and circles. So come in their own circles. So yet we do have to remember that as the life moves on, a huge amount of precautions, social distancing, but optimism in doing something good, optimism in bringing to the research review and trying to facilitate and not feel despair at the end of the day was something that we learned from this process. Thank you.
Thank you so much, Professor Veena Vaswani. It was wonderful.
Thank you.
We were able to relate to many of the experiences, the adaptations, the difficult decisions. So we all have had similar experiences. So I believe we have two questions. So I would request my IT team if we could unmute the participants who have raised their hands and take their questions. I hope Boni and Nicole, you can help me in that.
Good afternoon, Professor Vaswani. That was a fantastic, very illuminating talk.
Thank
you.
You.
Gave an excellent viewpoint. My name is Amir Jafri. I'm at the Center
We
of
know you.
Ethics.
Who doesn't know you? Yeah.
So, so I just, as a member of the National Bioethics Committee of Pakistan, I was just wanting to briefly relate our experience. We anticipated exactly what you did. So we made a commitment before the first COVID-related research project came to us that we will develop terms of reference. We changed our terms of reference of the National Committee, and we had a 72-hour turnaround time, which basically meant that we went mad in the past 6, 7, 8 months, meeting 3 times a week. And our meetings are at 10 p.m. So even tonight, I have a meeting at 10 p.m. to review COVID-related research. But we've managed to keep this going along with our core members and our co-opted members. But it is extremely important to have a buy-in from the committee members. As you're very right, everybody is a full-time person working somewhere else, and COVID has imposed great deal of expectations on us. It is, so the commitment for all committee members, the commitment has to be there that they will be able to do it. We managed to do this, but we are, of course, we're now burning out. We're finding it very difficult to keep the pace going. Our rate of review of proposals has reduced now because COVID is somewhat less now. However, these challenges are very practical. We don't get paid for this. In fact, our time, personal time and our office time and all of this is going along into this. So that has to be acknowledged at some level. Don't pay us, but it has to be some acknowledgement. At the present time, we are actually doing a research on our own experience. It's a qualitative research in which we are sharing our own experiences to see what worked and what didn't, and we can share that at some other time.
Yeah,
thank you.
Lovely. Thank you so much. Yeah.
Thank you, Dr. Amir. That was great to hear from you. Yes, this is just the time that was used in ethics review related activities, and the pressure was to complete the ethics review in an accelerated manner. So it required a lot of commitment from our members, and they have done such a fantastic job, I must say. So I would like to know if we do have more questions. I would request my IT team if we can have one more question maybe to keep a check on the time, and we will try to take further questions maybe at the end of today or on day 2. So I would love to hear the next question from Bunu Goso Umara. Please go ahead.
Thank you. Thank you, Dr. Diana, for making a wonderful presentation. My own is not a question per se, but is an adjunct to what you have said, having painted the challenges imposed by COVID-19. There are also some powerful opportunities and barriers, including the laws, parental control, health bias, and other barriers as from the following stages. List of 2020 would have stated that due to these are the following opportunities because of the COVID-19. They said, according to the write-up, a safe space or girl club combining life skill and livelihood training are increased popularly model for empowering adolescent girls that have been proven effective in a variety of contexts. Community-based program in Uganda, Sierra Leone, and Bangladesh have not only increased girl community-based program, increased girl self-employment and earning, but also reduced pregnancies, boosted self-confidence, and ease anxiety. Center-based skill building intervention, such as those in India, Nepal, and Liberia, have potential to help with post-COVID-19 economic recovery and other alternatives to early formation of adolescent girls. And also linking adolescent girls to mentors from other own communities from their own community has also been shown encouraging girls to push forward in their education. And a program in Liberia implemented during Ebola pandemic helped girls transmission from primary schools and lead to sustained impact on educational assignment. So we should also take this also the opportunities of the COVID-19 while dealing with this along. Thank you. Hello.
Thank you. That was great to have your thoughts. And I can see that we have a few more questions, but kindly allow me to move to the next presentation for today. And we do have a dedicated session for question and answers on day 2. And we will also try to return to you with written responses if we could not take all of the questions during the workshop. So with this, I need to move to the next presentation for today. So our next presentation for today, I would be sharing Pakistan experience. So can I request Boni to kindly share the slides for me? Right. Is it possible to slightly enlarge this view? Yes. I hope all of you can see my slides. So I would like to take you through the experience of ethics review during COVID-19 in Pakistan. And I'm delighted that we have few members from our National Bioethics Committee, because the Pakistan perspective would be better presented if we do have an input from the members of our National Bioethics Committee. I'm delighted that Dr. Saima Iqbal, who is chair of Research Ethics Committee of National Bioethics Committee, she has joined us, and this perspective would be more rich. This perspective would be complete if we could have her thoughts as well as part of my presentation. So what I would do is I would like to take you through the ethics review process, how we do it generally. And I would request Boni, can you go to the next slide, please? Yeah. So I would start by taking you through how ethics review process works in Pakistan generally. And then we evolved during COVID-19 public health emergency, globally as well as at the national level. So briefly talking about that, we would share our experience of ethics review of one of the COVID-19 related clinical trial, that is Solidarity trial. And with this, I would like to highlight few of the challenges that we faced. And at the end, I would like to end by suggesting a way forward. So a few words about Pakistan. Pakistan is a low middle income country, and we are in a chronic state of underinvestment in health. As a consequence, our key health indicators, we are lagging behind our peer LMICs in that. Our public health sector cannot sustain at times the demand of the healthcare delivery. So a 3/4 of our healthcare delivery is provided by informal sector that is less regulated. And when COVID-19 hits us in Pakistan, it was a challenging task to meet the requirements and the needs of basic health care delivery at that time. So naturally, ethics and regulatory system confronted with various challenges regarding the ethical review of biomedical research during public health emergencies. So, so a few words about our process, that is in general, that we follow for ethics review in general in Pakistan. So Pakistan National Bioethics Committee is the main official body to uphold the bioethical principles in all sectors of healthcare research in the country. So all the research studies, before we can start them at our institutions, these studies would require a review by institutional review boards, and these boards are mostly based within the institutions. Following that, national level projects and clinical trial would require a review and approval by ethics committee which is part of NBC. So that approval is mandatory. And for clinical trials, we would need a regulatory approval by Pakistan Drug Regulatory Authority. So this is how we normally do our ethics review process. So can we move to the next slide, please? So during current COVID-19 pandemic, we evolved international and as well as national guidelines were developed to steer the ethics review and the oversight process. National Bioethics Committee of Pakistan developed guidance primarily describing how it reviews COVID-19 research. So if I could go to the next slide, I have taken a screenshot of this rapid turnover review process for COVID research. This is the process about which Dr. Amir Jaffrey was referring to. So basically here what we have done is, what NBC has done is, they have devised a mechanism that we can complete the first review within 72 hours to meet the needs of an accelerated review to facilitate much needed research at the time of public health emergency. So, local ethics committees, they also followed similar paths adapted from this scheme, and they also moved to accelerated review. In our hospital, we also developed our guiding principles, and the aim was to facilitate much needed research in an accelerated manner. So, and we see this evolution globally as well. But the difference that is, there are certain inherent factors in the ethics framework of a country that would affect that how effectively they can adapt to this ethics review process during a public health emergency. So that would depend on many inherent factors of the framework, and I would like to go to those factors. So if we could go to the next slide, Bonnie. So there are certain challenges that are unique to ethics framework of Pakistan. Our national level guidelines, regulations, and training resources are limited on a few of the key aspects related to research, which are both related to research during pandemic as well as non-pandemic situations. In Pakistan, formal mechanisms to interact among IRBs, communities, and NBCs do not commonly exist. So with this, the problem that we face is that at times we are unable to share our experiences, to reach out to each other within our own country and learn from each other. At times, this is the problem. And at the same time, when we do have international guidelines and regulations to guide us, there are certain areas where we would need a national level framework to guide us in our local needs, that suits our local needs. That is important. So that was one of the challenges that we faced. In our country, institutional-based local IRBs are not registered or accredited by national level competent authority. So with this, we cannot comment. We will not know about the competency of the various local IRBs. So because there is no mechanism, so we cannot say this with trust. So these are few of the challenges that are inherent to our ethics framework. So if I could move to my next slide. So yes, so when so we, as Dr. Amir has already informed, that we adapted to an accelerated review process to facilitate COVID-19 research before we received these research studies. But the time that when we started to receive ethics review, COVID-19 related research, that was the time of fear and panic. That was the time when we were near to reaching the peak of COVID-19 cases in Pakistan. And that was the time of crisis because we were living in fear. We don't know what would happen and how large that wave could be. So that was the time. And this was the time when there was a lot of misinformation around COVID-19. There was conspiracies and there was unregulated misinformation, social media that could reach to us so easily. And that was source of mistrust among the public. And even being healthcare professionals, we were not even immune to this misinformation. That was just crazy. That was the time when we witnessed some retractions in the studies which were published, and these were involving the interventions which were the arms of the solidarity trial that was reviewed in those days. So that was creating a lot of confusion and at that time. And at the same time, the IRBs were facing the pressure to provide accelerated review. This was the time when we were not sure that what should we give to our critical patients, to a dying patient who is suffering from COVID-19. And at the same time, the researchers were being proposed, and the problem is that we were not sure if we have sufficient safety and efficacy data for those trials, for the interventions being proposed for novel coronavirus. So the IRBs were overwhelmed at the time. So that was the time the expertise of IRBs to review such studies, that was a big question mark. And we face that there is a need for training of IRB members when they are bombarded with COVID-19 related research. So the time was very critical. So, and because we need to ensure that how IRB members, can they, do they know how to review research studies during public health emergencies? Should they, how should they weigh societal good versus individual patient well-being? So that was a difficult time. So with this, if I could move to my next slide, Bhumi. So yes, and when we started to receive COVID-19 related research studies, as well as I've picked solidarity trial here as an example. So all the path that we follow included that all participating centers, they secured a review and approval from their local IRBs. Following that, this was reviewed and approved by National Bioethics Committee and then by Drug Regulatory Authority of Pakistan. Solidarity trial was a trial that was using adaptive study design. There were certain amendments. We quickly followed the initial review, and the same exercise was repeated for these amendments as well. And this is the process we are following, but yes, in an accelerated manner. We have been able to facilitate an accelerated review and keeping it rigorous at the same time. This is important. In one of the recent COVID-19 related research, this path was slightly altered, and NBC and DRAP approval were secured first, and then the studies were routed through local IRBs. So here I believe that it's a good news that local IRBs are slightly relieved, because we can believe that National Level Bioethics Committee is better placed and maybe better trained to review difficult subjects like vaccines. But at the same time, this indicates that we are still making adaptations. So this is the state of matters in Pakistan. So if we could move to our next slide. So having said that, I believe that this sets the need of a coordinated, efficient, and comprehensive ethical review process. Because if we do that, it can improve the quality, efficiency of health research by decreasing costs and approval time, and it would standardize the implementation of safety regulations for proposed interventions. So with this, am I allowed to unmute Dr. Saima Iqbal to have her view on ethics review process in Pakistan that we followed? Because I believe that this perspective would be completed once we hear that. So I would request my IT team to if we can unmute Dr. Saima Iqbal here.
Ji, thank you, Dr. Farah. I've been listening to your presentation, and I can relate to so much because we have been through this experience. You are right. When the pandemic hit us, a lot of us were not prepared on how to deal with the situation. We needed information as well. So I think and in particularly to your solidarity trial, because we had no information to go on. And one of the main issues was, is it ethical to test something that has been tested? Will it prove efficacious or not? Will it cause more harm? These were our concerns. But then we decided that, let's look at the international literature. So at this time, I remember when we were reviewing these trials, we were constantly looking at what the international literature was also saying. And that is like, changing on a daily basis almost. But yes, we've learned from this experience. We've realized that we need to improve ourselves. We need to keep up to date with the information. Our concern, the concern that you highlighted about the local IRBs, it still stands because we've realized with the number of projects that we received that many IRBs are not trained, and many IRBs are somewhat rubber stamp committees. So we were able to pick up things in protocols that the local IRB could not. And but you know, there have been some good organizations, Shaukat Khanam being one of them, which has a robust IRB process. But I hope this robustness is replicated in other IRBs of Pakistan as well. Thank you.
Thank you, Dr. Salma. It was a pleasure having you. Thank you so much. So this was an experience from Pakistan. We have already heard it, the experience of India. So we share many common challenges at the same time in different regions because of the basic competencies and basic infrastructure or the framework. The intensity of the challenges could be difficult. So there could be IRBs, there could be ethic review bodies which may have adapted so well, but yes, there could be certain parts of the world where we are dealing with the challenges. As Dr. Veena has already highlighted, even moving or adapting to online meetings was not even an easy task for many of us. So yes, so with this, I believe we can move forward to our break. So we will now take a short break in the program for 10 minutes. We recommend you take this time away from your computer, stretch your legs and seek refreshment. But if you would prefer to chat one-on-one with other attendees, private chat function is now enabled. You can do this. We will share a timer on the screen, so please return promptly so we can begin the next session in the program in the time. Thank you so much. Looking forward to see you after the break. So I'm looking forward to welcome all of you from the break. I hope that our participants are back from the break, and I'm taking this opportunity to welcome them again to the workshop. So we are now moving to our next very exciting part of this workshop. So I would request all of you to kindly turn off your video and microphones for now. And this is important to maintain the quality of this workshop and so that everyone can just enjoy this session. We will now progress with our next session, which again offers all participants an opportunity to interact and contribute directly to the discussions. So now we will be moving to designated breakout rooms. All the participants will be divided into 5 groups. In each group, one of the coordinators will be there to help moderate. Also, one of the attendees will be asked to be the appointed person to take notes of what is being discussed in that group so that he can report back when we come back to the main room. The aim is to discuss experiences, challenges, or ideas to address the topic of that group. So you will have 30 minutes to discuss as part of your group. After 30 minutes, we will all come back to the main meeting room to share our experiences and briefly report discussions to all participants. The appointed person of each group will then have just 5 minutes to debrief what was shared in that group. So now you will automatically be allocated to breakout room, and the breakout rooms will not be recorded. Your microphones and videos should automatically be enabled once you are in the breakout room. But if for any reason this doesn't happen, please touch the function button, ask for help so that we should be able to help you. When we start the breakout rooms, there will be pop-up on your screen to go to your room. Please accept that invitation. When everyone is in their room, we will post the activity instruction again to you in the chat. So please keep an eye on the chat box. At the end of the breakout session, there will be a 30-second countdown before you will automatically return to the main meeting room. When you come back to the meeting room, please check that your video and audio is switched off before we begin the next part of the program. So enjoy the breakout sessions, everyone. Looking forward to have you back in 30 minutes. So now I would welcome you again, all of you in our main room. So it would be great if all the attendees can turn off their cameras and their microphones. So welcome back to the main room. What a great discussion we just had in our breakout room. A diversity of voices, and I believe this is the beauty of having this workshop, that we were able to hear many of the participants, and I just wish if we have more time and we can have more voices. But this is the time that we would invite all the groups to conclude or to share their thoughts, but they have just discussed under their topics which were assigned to them. So if I could take the liberty, I would like to invite all the note takers from the groups so that they can share their thoughts with us, a summary of their thoughts. So if I could take the liberty, can I ask Dr. Sonu Bhaskar to give a summary of what we just discussed on the topic of the need of a rapid response panel for IRB members. So I would request Dr. Sonu Bhaskar, if you could unmute yourself, and we are looking forward to hear you.
Thank you, Dr. Faras. I think it was an exhilarating just to listen to different voices from different parts of the world. So in our group, we had representation from India, from Latin America, from Africa, and in Europe as well. So very varying voices. And the topic for discussion in our group was the need for a rapid response panel of IRB members. And our general consensus was that definitely a toolkit to that effect will be a great, great use for especially the countries which are probably not that mature, or institutions that doesn't have policies in place for rapid response. There were different level of maturity, if I could say it that way. For example, Dr. Vasanta Muthuswamy from Indian Council of Medical Research in India shared some of the policies and procedures they have laid out at the very beginning of the pandemic. And I think that could be a guideline for some others where the processes are not that mature. So at the beginning of May, they developed a guideline, not just for the researchers, but also for the projects and the reviewers. The response was quite quick, 48 hours turnaround, and they opened up the review for external peer reviewers, so subject matter experts. I think that's something which we can take for a toolkit to involve subject matter experts, given the variety of projects that we are receiving. Dr. Redwan Al-Nagar from Yemen, was a professor of medicine in Yemen, shared some lack of standardized review in the country. And I think that's quite pertinent in many developing countries. So the toolkit of that effect would be a great help that we can share with Dr. Al-Nagar. Dr. Loriana Mestra, she's an epidemiologist from Colombia, and she called for adapting submission response time. And there are concerns about the mistakes that peer reviewers can do given the short amount of time. So that's quite compelling in terms of the fears that even the IRB reviewers are facing within their group and committees. Dr. Miriam Dima from Pascal Institute shared the lack of early standardized protocols. So Dr. Memon from Pakistan talked about that such a toolkit will strengthen the IRB processes. And Dr. Veena Vaswani from India talked about guiding the process in terms of infrastructural vulnerability, a very important issue for researchers who are new to the field. As you probably know, that many of researchers from different domains are now swapping fields and have focused their research in the area of pandemic or COVID-19. Dr. Vanessa from Mozambique shared about that they're working with different ethics committee members. So probably a toolkit that the central committee oversees and can be shared with individual ethics committee of various institutions is the way to go. I think the most important point that I would mention from our group discussion was also raised by Navita Jain from New York. And I think that's very important these times about stakeholder engagement, where any response or rapid response to IRB process must ensure that stakeholders, the research participants' interests are paramount, and we must and any toolkit should strengthen that stakeholder engagement at early stage of the process and during the process as well. So I think that was very relevant and should be incorporating those comments. And not to mention that many other members shared some concerns about the standardized protocols. But with that, just conclude that a toolkit of this effect would be very desirable and can be shared in interoperable and different settings. So thank you everyone for sharing your thoughts, and it was lovely to listen to your thoughts, and probably we can work together to develop a toolkit that's acceptable and useful in your settings. Thank you everyone. Thank you co-chair for hosting this event, Dr. Farah Asif.
Thank you so much, Dr. Bhaskar. What a great summary. You've done a great job, I must say. And very pertinent points. We could have, we need to have an IRB, which a panel of IRB with diversity. We can work on their strengthening their training needs, as well as we can always co-opt their member. So we can incorporate a toolkit to have everything in place so that we can refer to it and develop a rapid response panel at the time of need. Thank you so much. So we could take this up for further work. We could develop it with all the group members of this subgroup too, or maybe other members can always join us in our further directions. So I would thank again Dr. Sonu Bhaskar for a wonderful job. Now can I take the liberty to go to our group 3. This is the need of special training for ethics committee members, addressing how to review studies during public health emergencies. So I believe that Mr. Chantal Patel would be the note taker, and he would share a report from his team. Please, I would apologize if I'm not pronouncing your name correctly, but I believe Ms. Chantal Patel from Group 3, from Julius Group. We are looking forward to hear a summary.
Yes, thank you very much. I'm a she rather than a he, and it's fine. And yes, so there was a rich discussion within the group. And so basically, you know, there was a consensus that training was required for IB members, and they saw this as being essential. In particular, the issue of confidentiality came up. And in some countries, there are national bioethics committees, but they felt that these didn't really work. And in particular, that there needed to be to have a difference, you know, that the difference between public health activities that are not research focused should be differentiated from research activities per se. And it was important to define exactly what we're talking about. Are we talking about research ethics, or are we talking about clinical ethics? Because obviously the training for both of those would be very different. And there was a consensus that there should be regular, ongoing, continuous training rather than special training, dealing with urgencies and emergencies. And there was also a view that there was a definite lack of preparedness during the pandemic, which left people without the appropriate time in order to skill individuals quickly. And there was a view that we should have specialist training internationally so that we could share good practice amongst the international community. And there was also a view that data sharing and absence of regulatory framework meant that perhaps a lot of the things that we could have done wasn't available. But if that proper training had been in place, then that would have helped enormously. Ethics members must be committed, understand their role and responsibilities and what their role and responsibilities are. They should also understand the socio-cultural norms. And there was a view that there should be common methodological review approach, and that these reviews then could be conducted online. Ethics committees need to also understand vulnerabilities and protecting the individuals. There was an overlap between research and practice that needed plugged. However, having said that, and in particular, one of our contributors from Nepal made the comment that public health emergencies has also given us some challenges and opportunities, in particular in terms of the digital platform. For example, in his country, there were more than 500 proposals, research proposals, but at the same time needed to train up members very quickly in order to deal with the surge in applications, and in particular in terms of those proposals in relation to pandemics. There's a difficulty in training the layperson, whilst members could provide assistance to lay members, but there was an issue in relation to time available in order to support those individuals and to conduct reviews. Online platforms have certainly helped enormously, but there was also a view that in relation to the ethics research reviews, that there may well be a two-prong attack, a two-prong approach, in the sense that some of those could be expedited dependent on the risks associated with the research. There was also a need to appeal to healthcare workers to participate during a pandemic. And finally, there was a consensus that there should be in-depth training to ensure all members have the relevant knowledge and ability to be able to conduct these reviews and be ready during a future, during current pandemic and future pandemics. I hope, Giulio, that I have captured everything that the group discussed. Thank you.
Thank you so much. So, Giulio, would you like to add something?
No, I just want to thank Chantal for such a good work.
Amazing work, I must say. This has been such a rich summary, beautifully captured, and the diversity of the points and the richness of the points. I'm just amazed. Thank you so much, Chantal Patel, for this summary. And as I said earlier, that we can always take these directions for future work, and among this group, among the participants of today's workshop, we can always try to work further on the ideas that we have identified. So this is just such a rich experience to learn, to hear the voices. This is just great. So now can I take the liberty to move on to group 4. This is identifying successful innovations, adequations or adaptations to facilitate sharing and implementation, adequate responses to public health emergencies. So I believe this is Wandini Kafoi. This is Jackie's group. And can we have you, I'm again sorry if I'm not pronouncing the names correctly. So I believe spokesperson for group 4 is Wandini Kafoi. So we are looking forward to hear you. Please go ahead.
Hello. Hello, I'm Wandini Kafoi. Hello. Hello, can you hear me? Hello?
Yes, go ahead, Marguerite.
Yes, we can hear you.
Yeah, actually, I have been in and out. I'm at the office, so I can ask other members to contribute. So, but when I came back from I met the breakout session discussing about the ethical issues on the electronic informed consent, how ethical it is. That is the point where when I came back, I found the group was discussing, and actually they were discussing how ethical are they? Are they, like, if you want to collect information from participants through these Google Forms, how ethical it is? And most people, there's one member from India suggested that it is that much ethical unless you send those informed consent through their specific emails. And I can, since I haven't been around throughout the discussion, I can ask the host to help me about other people's. Hello?
I'll assist you, Mwanaidi.
Yes.
Yeah, because I did take the points during the group discussion. So I will just...
Yes, please help.
You can see me? Okay.
Yeah.
We had different opinions from different places within our group. It was divergent. And we started off with a group from Bangladesh, that's Dr. Shahnaz. She indicated that before COVID, they were using the physical system, but then after the pandemic, it became difficult to get the hard copies. So they moved on to having meetings through Zoom, and then they would get the soft copies sent to each other. So they found that it is more efficient, rapid in reviewing the proposals, and they would advocate for that. The other issue would be when they have physical meetings, sometimes the reviewers are not available. So one of the advantages of having the online meetings was that most reviewers are available. And then it shortens the time and communication of meeting and discussing and also making decisions. We also had Dr. Pankaj from India, who indicated that in India they have, even before COVID, they had a better organized system, an ERC system, which existed before. And it was being regulated. He mentioned ICMR. I've seen he had also included it in our chat, that the ICMR came. It was there before, but then after COVID, its role increased greatly because they came up with they improved the ERC process. That is the guidelines which they gave to most of the committees. And they had better systems. They came up with the new innovations. So the electronic submission system became more centralized during the COVID, and they have their systems are more secure. They have a way of securing the data. Then he also mentioned that going forward, it would be good to also come up with a hybrid model of physical and online system where we can evolve ourselves better to adopt this. And some of the software, he indicated that the software is not available to everywhere in India. He has put the software in the chat. We have the ICMR, and then he also said they have iecmanager.org. Then for Malaysia, they indicated that they already had the systems, it's just that they were not as active, or they improved during the COVID, and they normally would upload documents on the system, and then they would share within the review members. and using Zoom, they would have meetings and then discuss. So one of the key issues that came up was a question of using the online consent form, using the use of Google form for informed consent process. There was one of us who asked, how ethical is this? Because one of the questions that would come up is, some people have the habit of maybe sharing forms, so you would not know who has actually signed the form, and then you would not know how the process, what happened before somebody actually consented to a particular form. So we need guidelines that would be able, or we need innovative ways that can be able to improve this. So, but we had somebody from Colombia who said that they have been using Google Forms and it has improved their time between sessions. They have had a good experience with the Google Forms. So, and then there was also the recommendation of maybe in the future, instead of using the Google Forms, we can have a platform which records information, whereby you can be able to talk directly to a respondent or a patient, and then it is recorded. So you would be able to be sure that the person who has given their consent is the person who actually went through the process and they understood the contents of the form before signing. Another way would be like, there was a member who also mentioned that they use the Google form, but they use a secure platform. Like before you access the Google form, you must access a secure platform, which confirms that it is actually a particular person who is accessing that particular Google form. So that is a summary of what we discussed. I would also want to add that from my country, in Kenya, we had the Rhino Ethics platform, which is also for IRBs, but it had initially not been taken up well. In Kenya, the only organization which was using it before is Strathmore University. And then the others were very slow in taking it up. But last week, we've had the regulator actually encouraging and also giving recommendations for committees to adopt the online system. So that is the bottom line, is that going forward, we cannot avoid having the online system. They eventually make things easier and better and faster. What we need to do is come up with innovative ways of improving how it's done and how to also ensure that everything done is ethical. Thank you.
Thank you so much. Thank you, Kofoe, and thank you, Mercury. This was great to hear about the innovations. These are all the things that we can, I believe all of us can relate to. And so I believe this online, the need to switch to online systems is very pertinent at this point in time. And taking this opportunity from this platform that we are hearing so many voices, there are IRBs which are living in paper world. So I'm not sure, but it would be great if we can explore this area more. Maybe following this workshop, we can get in touch with each others and find innovations for the IRBs which are still struggling or still working in paper world. And are there any options for them? Is there any way they can go to online systems, online IRB submission systems? Online consent form again is something. This is one request that we encountered. We received from our researchers, because we have switched to telemedicine, and in many cases for ongoing research studies. We needed to have a telephonic consent or an online consent, and especially in cases where our potential participants were in isolation or in quarantine, or because of certain precautionary measures, we were not able to see them in person. These were all very needed innovations. So I'm just hoping, I'm looking forward to it, that we can take up this initiative following this discussion, having this opportunity of having all these members from around the world and work on it further. So now slightly changing the flavor, can we go to group 5? It is engaging communities effectively at early stages. This is something, community engagement, we received few comments in relation to community engagement in our first part of the presentations. So an area we believe has been neglected in some areas, unfortunately, but this is something a must go area. So we are looking forward to have Irma Delphin with us, who can present this her summary. I believe this group was coordinated by Satya. So can I request Irma to kindly unmute yourself and turn on your camera, and we would love to hear from you. Thank you.
Thank you, everybody. I was the note taker at the community engagement group, and we discussed. People contributed a lot of important points. There were we thought about both challenges and solutions about community involvement in research in general, both in general to research in general in our countries, and particular cases that have been rising through to COVID. So, for example, Ana Palmero in Argentina, she told us how her perception working within the Pan American Health Organization and also within the Ministry of there. She perceives that there's a lot of failure of communication with the community. There are no strategies for community engagement, and this gets complicated and got complicated with a large amount of information, including false information during the COVID pandemic. And in particular, there was this failure in community engagement reflected, for example, in the Solidarity trial, that the fact that there was no way to change the informed consents or any of the materials just to suit them better to the needs of the local communities. And also there are problems with COVID in identifying the community that was needed to be engaged with, because it was all the community, it was the whole urban areas, which is not the same as the strategies that are normally used to engage with a particular rural community that you can direct your efforts to it. Then Dr. Rafaela Rabin also agreed with this point that really community engagement is not something that is in the researcher's mind by default. It seems kind of optional, and it is complicated. Yes, there are all these regulations from the people who runs the big multi place trials, the global trials, that things cannot be changed, and so it is unfortunate that large trials do not even consider or anticipate that there's going to be a need to adequate and make local changes to the platforms and to the materials. And her point was that complexity should not be an excuse to not doing it, because we have a responsibility to our people and to our communities, and not so much to the global north who is running these big trials. Then Dr. Laia Ruiz-Mingote, she is a community advocate, and actually she is part of an initiative that's covidadvocates.org, and they are really working about how to make this involvement better. But she told us that normally people just thinks about advocacy and engagement as an afterthought, just after when everything is in place. Then they contact them just to, hey, can you help me to improve recruitment or retention on how and that's not the way it should work. This should be something that happens beforehand, and that really engage the community from the beginning. It is always a problem. It has been seen over the years in TB studies, malaria, HIV/AIDS. It's always not engagement with the community case creates mistrust. And there's for example the instance with the trial for prophylaxis pre-exposition for HIV. It was a real problem because community was not consulted enough in advance. And Dr. Minri Grief in South Africa also agreed with this point, and she said that fear in communities and stigmatization in cases like a global pandemic with no known cure, as the one with COVID, fear and stigmatization, it's a real thing, real things, and they affect community engagement. And also in COVID, it got particularly complicated in South Africa because government regulations that were in place just for public health measures were in fact a hindrance or an obstacle to do the usual community engagement strategies, because you could not put a lot of people in a house, or you could not have assemblies of the communities to communicate strategies or initiatives of research. But again, Dr. Yunus Muiti in Kenya, he told as a clinician that it is important to make sure that even if it's difficult, it is doable, that you can establish appropriate consent and appropriate community engagement, even in communities or in situations that are complicated. Even if people cannot read or write, you are responsible to communicate the whole ideas to them, and it is possible to do, and it has to be done. Then Dr. Amir Jafari in Pakistan, he particularly, he talked about how COVID had this particular circumstances there, that in his views, the desperation of the situation, finding that COVID was, it is a disease with no known cure. His view is that people were more willing to be involved in research because of that situation, that normally it is more complicated to get people involved in research, but in this case, everybody was willing to do anything, to get involved with initiatives for treatment, initiatives for everything, and it did turn into a kind of a problem because people was really receptive to these initiatives, and even demanding them even before actual trials were conducted. And he talked about the example of convalescent plasma that turned out to be a complicated situation in which there was even a commercial interest on it. And so his message was that one has to be careful in how to engage with the media, and also that the speed of the things happening during a pandemic creates the complication that even slight problems in research can be very much blown up and has a very big impact on public trust.
So,
And and then, but like for solutions, both Dr. Armando Simao and Dr. Matilda Kichila Muntali, they talk
Irma,
that
can I interrupt you? I'm so sorry. Can I interrupt you? We are
out of
struggling
time,
with.
sorry.
So can I request you to kindly wrap it up, and so we can move to our last group. So please, I would like to, if you could wrap it up in next 1 or 2 minutes. That was just a great summary from Irma. So community engagement, of course, it is so important to respect the community and involve them as a stakeholder. So that we have their trust as well. This is so important. And with all the innovations and the responsibility to go to media responsibly and spread the word as it should be. This is so important. So now I would like to move to our last group. This is Roxana's group, and this has discussed the need for toolkit and guidance to be created for future public health emergencies. So I believe Dinta Suresh would like to present this, and I would request Dinta Suresh that can we kindly contain ourselves to 5 minutes? That would be great. Please go ahead.
Thank you for giving me an opportunity, and I am really sorry that I don't want to go for the video. I hope it is okay. Hello.
Yes, it should be okay. Please go ahead.
Yes. So our group was the first one with the need for toolkit and the guidance to guidance for developing any SOPs specifically for public health emergencies. So we have representatives from Africa, Latin America, India, and I think UK. And I'm sorry if I missed somebody. So we started with asking, sharing our experiences, whether they have a specific toolkit, a specific checklist or SOPs or any toolkit working specifically for COVID-19. The representatives from the participants from various countries suggested that they don't have. Dr. Chitra from Hyderabad said that they don't have a specific checklist or SOP. And the preliminary stage for them to understand, especially for COVID, was very difficult. And Brinda from South, most of them said that they don't have a specific toolkit. And one of our participants, Francis, I don't remember the country, he said that he had been involved with developing guidelines and for IRBs and ethics. Hello. Hello.
We're listening to you. Okay, Dinta,
Okay.
thank you.
Okay. He's been involved with developing guidelines for IRBs and ethics committees for COVID-19 clinical trials. So in the preparatory level, they started by writing the recommendation. They have done the surveys for ethics committee members for specifically for the public health emergencies, and they have developed the recommendations, and they have been working on projects for developing recommendations for Eastern Europe and Central Asian countries. And he also suggested that the ethical review, specifically the research review of what happened after the trial and what happens if the vaccine get approved, they're focusing more on that. And the vaccine research review is very challenging. Then the Gerald from Uganda, he said that there is no specific guidelines, and as part of that, so the research work got suspended, and the research committee chairpersons came together and they have held in a meeting and said that the various issues they have faced, and those issues were addressed to a certain extent, and now the research work has been revived, but still a standardized checklist or SOP is being pending. Then another interesting suggestion from Rosemary. She's from Zimbabwe, currently a postdoc student from in Oxford University. They have developed guidelines for research in public health emergencies, specifically for COVID. But they were being asked to add more input for the general and to come up with more ethical guidelines. And Sophie from Chile said that they have the vaccine trials for COVID-19. They have 4 to 5 trials that have to be reviewed, and they found out that it is very time consuming. So decided with the Ministry of Health, to speed up the procedure, they set up a central committee, and the trials to for the trials and to have a general recommendation. So they have all the trials will be locally reviewed and then they will be discussed in the central committees. So in the local review, they identified some of the main issues that was identified was there will be problem with the selection of subjects, and there was problems with informed consent and the risk associated with pregnancies like contraception, if it is required, whether it should be given or not, and insurance policies, updates specifically on any adverse events, and these kinds of issues were being addressed. Clinical trials were developed in, and they also found out that some of these clinical trials were developed in very small offices and they don't have enough equipments to follow up any adverse events, whether it is occurring and what to do after that. And some of the protocols didn't have an external steering committee and who were the actual readers of the research. And what she said is somebody from cardio, somebody from nephro, all are applying for these clinical trials. And one of the most interesting thing which she said that it was very difficult to work with people from different committees, and it was literally fighting because of the conflict of ideas from different perspectives. That was her experience. Then Chitra also suggested that she works with vaccine trials for TB in Hyderabad, and she also have somewhat similar experiences. And the group or come up with an idea of harmonized guidelines. We should have a harmonized guidelines which will be developed in one part. Zaid also said that they don't have an ERB and they have difficulty in reviewing trials and trials, and the suggestion came up was the harmonized guidelines. And then Mary said that she have done a study, and when the time and she never knew about the procedure, so she faced some of these challenges as part of that. So finally we have discussed some of the questions also which the group addressed. So the final part was coming up with the ideas. So the main idea which everybody was focusing was with the Sophie's idea of they have the intermediate way of local IRBs and the national IRBs. So how it worked. So Sophie have given a brief idea about that. So according to Sophie, they have a national IRB for COVID, and Francis was asking that IRB and how it works. So what she said that it was very difficult to fulfill the requirement. So they did a local committee chair and will join, and the local committee chairpersons will join the national advisory committee, and there they set up the guidelines, and these guidelines had been executed at the local level. And they had an intermediate situation where they have a central advisory committee, and the final approval is been given by the local advisory committee. Then the final one idea was this given by Roxana, is they developed a checklist for the enrollment plan because they found that adverse even mitigations, like how they are going to address these issues, were very less addressed. And Sophie also suggested that most of the time the people there is a gap, like people always feel that vaccine trials is somewhere like they are given the vaccine, so that gap needs to be addressed. That trial is very different from difference between a research participant and the patient, and they are not going to directly get the medicine after that, and how this could be addressed. Then final suggestion was by Rosemary. She suggested that all the resources, how much they have worked from all part of the world, should be available easily, and it should be online, so that whoever who wants to continue the work can directly go and check how much work is done, what is left, and from where they have to start. So it will need less resources, less work time, and it will provide a great platform to know the work, how much it has been done. So it should be available online and pick up from where it is left. This, I hope I have addressed all the points which we have discussed, and I ask Roxana if I miss something she can add. And thank you.
Thank you so much. Thank you so
Kudos
much.
for Dinta. She did a wonderful job. Wonderful job. Thank you. No additional comments. Thank you very much, Dinta. And thank you for group one. Great working group together. I look forward for more. Thank you.
Thank you, Roxana. Bye.
Thank you, Roxana, and thank you so much for this great summary. So this was just great to hear the diversity of the challenges that everyone faced and the solutions they came up with. This is I believe this is the most rich part of this exercise, and I just wish if we could have more time and we could discuss this more, but I assure you that we can find areas of common interest, and we can work on these in following this workshop. So I would be looking forward to that. There are great resources being shared in the chat box. So I have been missing few of those, but I'm looking forward to have a detailed look at the chat box as well. So there are certain resources that have been shared there. We have a dedicated section of question and answer on day 2. We will try to answer all of the questions and take up all the comments. But if that won't be possible, we will try to get back to you with some written responses along with the recordings. So we had detailed perspectives from India and Pakistan. We heard about the challenges from around the world. That was the rich part of the discussion. On day 2, I'm looking forward to it that we would focus more on the solutions. So with this, I would like to end the session for today. We have to. So I would thank you, all the participants of day 1. The recordings of the session along with additional material will be shared through the link in an email. You will continue this workshop on Friday 13 at the same time. You will not need to register again. The same link you received earlier will be used for the workshop on Friday. Thank you very much to the panelists, coordinators, and for their participation. We would need to close the session now, and I'm looking forward to see you on Friday. Thank you so much. Goodbye.